Assalamu alaikum, everyone. My name is Luqman, and I'm the coordinator of Alfaisal MedHub under the umbrella of the International Office at Alfaisal University, Riyadh, Saudi Arabia. I am honored to be your host for today. For those of you who don't know what Alfaisal MedHub is, it's an initiative under the umbrella of the International Office, College of Medicine, that aims at creating an online global community of medical students. Alfaisal MedHub covers a broad range of topics that are common to medical students all around the world. Our primary objective here at Alfaisal MedHub is to help medical students learn more about the career opportunities available after graduating, as well as the steps involved in pursuing them. Since medical students are always confused about the path that's ahead of them, Alfaisal MedHub's Career Guidance series addresses this challenge through the perspective of accomplished and experienced seniors. As you all are aware, we are now conducting the continuation of the CGSKC specialty webinars, which, as the name suggests, will revolve around specialties. These webinars will be delivered by current Saudi residents who are distinguished alumni of Alfaisal University and have matched to the most competitive and prestigious Saudi hospitals. The aim of these webinars is to provide medical students and interns, especially those applying for the current match, with a comprehensive idea about how certain specialties are, and aid you all in deciding and finalizing a specialty of choice in the future. I'll show the next slide, which is our schedule for today. Yes. We'll be first having our talk by Dr. Alfadda. I'll introduce everyone else too. We'll be having talks by Dr. Alfadda, Dr. Mahan Abad, Dr. Hamad Al-Tray, Dr. Abdulaziz Bakhshween, Dr. Abdullah Khani, Dr. Rakan Al-Saad, Dr. Abdulaziz Abid. These are all our speakers for today. We are really honored to have them for our webinar today. And Doctor, we can begin. I'll introduce you and then we'll move on with the talk.
Sure.
Our first specialty talk of the day will be given by Dr. Anas Alfadda. Dr. Anas is a family medicine R1 at the National Guard, King Abdulaziz Medical City. Dr. Anas, thank you again for agreeing to give this talk. You can start whenever you're ready. We'll stop sharing.
No, thank you for having me. So if you allow me to share, please.
Yes, Doctor, just a second.
Okay, can you see my screen?
Yes, Doctor.
Okay, so first of all, thank you so much to you, Luqman, for this kind introduction. Do you mind maybe sharing the host, because I think I'm getting people to admit here at the top of my screen.
Yeah, we're admitting them, Doctor.
Okay, sounds good. So thank you so much for having me today. I'm beyond honored and excited to be presenting to my own school about the specialty that I went to, and hopefully this would be a brief and informative presentation. So to start off with, I'll just share a brief outline on what I'll be presenting today. So starting off, I'll explain what is exactly family medicine and how, what is exactly family medicine, what's the intricacies of family medicine, and what's the core of family medicine, so everyone can get a solid and a great foundation on exactly what is family medicine. And then afterwards, we get into what, how does family medicine residency works, or what exactly is the family medicine role. And then we can explore so many different paths and careers where you can go beyond or after family medicine. And fourth, I'd like to talk about why I picked family medicine for me personally, and some of the reasons me and my colleague actually picked family medicine. And the fifth point is how to get into family medicine with the current residency requirements and what exactly they're looking for. And finally, the future of family physicians in Saudi Arabia and how does this play and what role do they play in the model of health overall. So, so what is exactly family medicine? So the most important thing, or if you can get this thing from today's presentation about family medicine, I think that would be enough. So family medicine is a biopsychosocial specialty. And we mean by this is that it deals with the medical diseases, chronic diseases that you know, and then you can introduce two different, let's say, spheres or elements, which is the social and the psychological. So you would be treating a patient for his medical condition, the biological condition, whether it's diabetes, hypertension, chronic diseases, and so on. And then you would also explore two other aspects, which are the social. How does this person fits into his family, how is the social economic status, and the other social aspects of his healthcare, and how does this tie into his overall treatment and his overall condition. And lastly, which is quite important, is as we explore the biological aspect and the social aspect, you also get to deepen this relationship with the patient by actually examining the psychological aspect. So you'd be treating so you'd be asking about mental health, general anxiety, depression, and so on. And this creates a really special relationship between the doctor and the patient as it looks into several aspects of the healthcare. So the second thing is family medicine, you would be working from a clinic. So you would have a couple of clinics per week, and then you would basically have patients on those clinics. So it's strictly an outpatient setting, even though we'll explore later on how it could be quite different. And lastly is that generally people come to family medicine to treat sometimes the most urgent issue, and then you would reduce the developing new ones of different conditions. So basically someone would come to you with, let's say he would come to you with, let's say, fall, or maybe he did some labs and he would like to check them with you, and then you would see, well, his cholesterol level is high, his blood sugar or his hypertension and whatnot, and then you would aim to fix that core issue, and then you would look at the other aspects, such as maybe he would have another let's say condition, such as maybe let's say another condition such as let's say osteoporosis or whatever, and then you would try and reduce that in some sense. So now, as we explained what is exactly family medicine, I want to get into how does generally the family medicine residency go. So basically, you would the family medicine residency is a really short residency with 3 years in general. They reduced it from 4 years. So basically, you would start in a different module. So you have different modules from the Saudi Commission of Health Specialties. So you have module A, module B, and module C. And how does this work is that you would have to do around 3 to 4 months each year of family medicine, and then you would rotate in other specialties afterwards. So you would do, let's say I started my residency as an R1, doing 3 to 4 months of family medicine. And then I went into rotated across different departments, such as internal medicine, ER, orthopedics, ophthalmology, ENT, and whatnot. And just so you can enrich your, let's say, knowledge, since you're basically dealing with so many different diseases during your patient care. So this would be a typical year, and then the next year would be the same. same with different, let's say, rotations. You would get OB, obstetric and gynae, you would get psychiatry inpatient and outpatient, and then you could get different, let's say, selective rotations such as radiology, ophthalmology, ortho, ENT, and whatnot. And lastly, the third year would be mostly you would spend it all in family medicine, except for 3 to 4, let's say, weeks. So 4 weeks rotation, you would be spending it one as an elective, where you would be, you could go to a different hospital, you could do different, let's say, rotations, you would pick the rotation, and then one, it would be an ER to serve during the 3 years. So this is the general, let's say, high level structure of the presentation of the residency. And then you would have a weekly activity, which is called a weekly academic day activity, WADA, which is one day of the week where you would do it basically virtual from home with the current situation. So it's like a 4-day week to the resident. So now I would like, and if you have any questions, please feel free to ask them, or if you would like to ask them at the end, I'd be more than happy to answer them. So now, which is one of the most important, let's say, things to me is how you would proceed after family medicine. Where exactly would you go? Some people would argue that it's a small or it's a relatively short residency, and then what would be your career outlook afterward? I think one of the most special things about family medicine is that there is a lot of areas to maneuver in your future path. So there are so many things that could be done. So how I've split them here is that we would start off with medical, if you want to pursue it strictly medical, and then non-medical. In medical, you could pursue a clinical, let's say, a career, or a non-clinical career. So by a clinical career, we could say a special community fellowship. So you'd be mostly focusing on residency in, let's say, OB or in pediatrics. So it's a special, let's say, population that would be targeted during this fellowship. Another thing, it could be like a macro disease type fellowship, such as diabetes, hypertension, and many other different, let's say, diseases. And then you could also go more deep into it, basically into a micro disease specialty, such as, let's say, getting more deeper into, let's say, diabetes and whatnot. And basically you'd be crossing the line between a family physician and an endocrinologist. And this allows you to take your time, and if you want to really get into, let's say, if you want to really, let's say, move from being a generalist into something really, let's say, something really specialized, you can do that also, which is a great, let's say, approach, or a great benefit to this residency. The last thing is you could do also an emergency medicine fellowship, and basically by doing that, you can basically work as an ER, almost like an ER consultant. So you have this also option to do if you're maybe tired from doing regular clinics and whatnot. Of course, the great thing about these fellowships is they are very short, relatively, I would say. So it's a 1-year fellowship. So you could take 1 or 2 or even 3 fellowships, where you would strengthen your foundation into either different diseases, or broaden your horizons or your opportunities into the clinical pathway. So this would be in terms of clinical. And then in terms of non-clinical, you have so many other options that you could go with. So a lot of, especially with the Vision 2030 and the structural changes that are happening to the healthcare with the privatization and whatnot, what's happening is that there are so many other opportunities that physicians can proceed or family physicians can approach. And some of this are like medical informatics. So you'd finish your fellowship and then you could get finish your residency, and then you could get into let's say a medical informatics fellowship or a master's and whatnot. And this is really beneficial as you could serve different positions in the hospital as an administrator, as an CIO, chief information officer. And I think especially with the progress of medicine and the progress of technologies that are happening in the current day, I think medicine would definitely be different now from, let's say, 20, 30, 40 years ahead. And I think I urge you to ask yourself, and I mean, we look at the great doctors and surgeons and whatnot, and we would say, oh, wow, I wish to be like him. And I think they would, they didn't have this idea about how exactly their specialty would turn out to be at the end. And I think just think about if you could ask yourself this question: what would this surgeon do if he was in my place now, approaching this decision in the future and the future outlook of medicine with the relative integration of technology more and more? So this is one thought that I urge people to think about. The second thing is you could get into hospital management. A lot of family physicians are getting into hospital management, where it would give you the opportunity to serve as an administrator. You could be an administrator with some, let's say, clinics during the week, maybe 1-2 clinics. A lot of physicians at the National Guard, they're serving as administrators slash clinicians. So they're doing 2 to 3 clinics per week, and then they're serving as administrator in the hospital itself. So basically it gives you this variety of let's say different let's say it's just a change from the regular clinical path, and you would see in terms of a very high macro level approach to the hospital and how does it work. And then you could get into the really small details of dealing with the patient, treating them, and establishing that relationship. Then you could also get into public health, where you could serve for the Ministry of Health, MOH, where there are so many different positions you could help and serve, such as health clusters and whatnot. And lastly, you could do community medicine, where you would be focused on a special community and serve that. So for non-medical, there are also a lot of other jobs that could be approached. So for non-medical, of course, the most obvious one would be management consulting. I did before actually I had this idea of going into family medicine, but I was not really sure. I wanted to try the other paths before really going into family medicine. So I did 1 year of management consulting strategy at Boston Consulting Group, and I saw how different work is and how it's different from other things. And they're very happy to take, and they're very eager to take doctors who are graduates from medical school or after their residency to serve and advise clients in across different fields and industries, and mostly focused on advising ministries of health across the region, in MENA region, different governments and whatnot. Then you could also get into corporate jobs, where you would be you could work with other, let's say, insurance companies. You could work with other let's say pharma companies, where you would be the doctor advising on different let's say clinical approaches, or how they would approach different, let's say how they would approach different let's say different markets, how they would approach different, let's say, relationship with their clients and whatnot. And this is a 2 corporate job at the top of my head. I think there are so many other more that you could find. The other thing is what's really what's really emerging currently in this day is medical and healthcare startups and startups in general in the MENA region, which is Middle East and North Africa. There are so many opportunities to build your own startup, whether it's in healthcare or outside. Funding has reached an unfathomable amount, especially in the last year. Venture capital firms are abundant. There are so many opportunities to start your own startup. Actually, one resident with us, he's starting a telehealth startup where he did a partnership with Mayo Clinic, with UCLA, and basically it's a second opinion. Type of model. So patients who are not really satisfied with the let's say opinion that they received here, they would get a telemedicine call with an expert opinion, other expert opinion, of course, from different hospitals across the world, some of the most advanced hospital, who he would save so much instead of going and traveling there and all of the hassle. And it's growing tremendously. Another doctor, he's not with us, but the doctor who actually created Wateen, which is the donation for blood, was actually going to pursue, I believe, family medicine, and then went into medical informatics and started his own startup, which is Wateen. And now he serves as, I believe, the CEO of that company. Lastly, if you would like also to pay back to the community and really go with that, you could go into NGOs, which are non-government organization. So they would be like a non-profit organization. You would be help serving Doctors Without Borders, Bill and Melinda Gates Foundation, different types of, let's say, organization that you could also push with them in terms of your career. Of course, the great thing about family medicine is that you don't have to be, you have so much free time that you could approach, let's say, a couple of them together. So you could be an administrator, also a clinician, also you could be an advisor to some of these companies on the side, which is a really blessing that we have in this residency. So now I'd like to talk just a bit maybe from my personal view and then the general view, or why I picked family medicine and why generally people tend to pick family medicine. So the reason I picked family medicine actually is that I really wanted to see patients to live their best life. So I really wanted to see them live their best life. So how could this be done? I mean, you could be the surgeon that pulls the tumor out of the patient during in a surgery and whatnot. However, the damage has already been done. And by actually doing your tests, doing your X-ray, doing your preventive measures, you're actually helping and preventing the patients from getting to that stage, which is basically making them live their best life, which is, this is one of the main reasons I got into family medicine. Of course, this is from my own opinion, personally. There are other, let's say, people and other advantages on why you would get into family medicine. First of all, is that it has the shortest residency, I believe. Maybe preventive medicine is shorter, it's 2 years, but I think it's the shortest of the core, let's say, residencies. So basically, it's 3 years and then you're done. You could serve as an assistant consultant. We have colleagues of ours who are 28, 29 and already assistant consultant in this field, and they're happy enjoying it. And then the second thing is that you have no on-calls. You have no on-calls whatsoever. So you have a clinic in the morning, clinic in the afternoon, depending on your schedule, and then you're done. That's it. You go home and you don't have any on-calls. You're not the first on-call, second on-call, or even as a consultant, maybe a third on-call. So this is one of the great, let's say, advantages of family medicine. Also another thing is that as you approach, like after you become a consultant, inshallah, and inshallah we'll see all consultants in different fields. as you become, because you would have basically 5 to 7 clinics per week. So it's like you would have 3 days, half day. So it's 1 clinic per day, which gives you a lot of time and a lot of freedom to do so many other things, either to focus on generally your life, your family, enjoy life, and have so many different hobbies and whatnot. So it's relatively free. The third thing is that people pick family medicine is that they would like to be a generalist, and a generalist, I mean, is that they would be like a consultant and all of that. However, he would like to treat so many different diseases, and there is a really good feeling about being a generalist in terms of different diseases, is that you can treat so many different diseases, and you would be the best doctor to go to, whether it's in your family, whether it's in your community and whatnot. Generally, when you get into family medicine, you go to family gatherings, you would have your uncle ask you about his hypertension medication. Another aunt would ask you about, my kid fell and whatnot. Another one, you could also get into the mental health. So it's really valuable. Now you could really connect and click with everyone in general. So fourth one is the largest area of maneuver. I know I'm going over time. I'm sorry, but I think we started late. So I guess Luqman, can we go on a bit more, or?
Yes, doctor, it's fine if we go over like a few minutes. It should be fine.
Sure. Okay. The fourth thing is that you have a largest area of maneuver, as we spoke earlier. There are so many things that could be done after residency. You have so much free time that you could approach so many different, let's say, careers. The pay also, by approaching different one, you could get a really high pay with that, more than full-time consultants in different specialties and whatnot. Fifth thing is that you would have set hours. So basically you have a clinic from, let's say, 8 a.m., 8:30 a.m., and then up until 11 or 11:30, that's it. And then if you have a PM clinic, it would be from 12:30 or 1 till 4 or 4:30, and that's it. And lastly, I explained is the free time you get, which is quite valuable if you're not really putting medicine as, let's say, as a core, or let's say you're not putting medicine as the priority in your life, and you're trying to do other things, whether it's focus on family, whether it's focus on startups, whether it's focus on so many other things. I think it's one of it. So just quickly getting into family medicine. So I think this is quite unified across different specialties, which is before residency. What you need to focus on is the GPA, of course, and then the SMLE, which is the test Saudi medical licensing exam, and then the CV, and finally the research. Research, just to show that you're really, you have, let's say, you're targeting family medicine from an early on. And then during the residency application, you would try to do the golden months, which I believe January, February, and March, or December, January, and then February, your golden months. Try to do electives in family medicine. So people would, let's say, program director would look at you, they would see your interest, and they would work with you and see how well you work with them and how we would fit into the program with different cultures and different let's say, programs. And then during that time, you also get, so the electives also feed into the letters of recommendation. So you would go into a program, they would see you do well, and then you could ask them for letters of recommendation that would help in your application in that program, or even in other program, as let's say different consultants know each other. And then lastly is the interviews, excelling in them. Basically, you would get into the interview, they would ask you a couple of questions, why you picked family medicine and why us. Generally, there are so many, let's say, different answers to that based on yourself, and there are some generalist answers you could add. And I think if you prepare for it well, and I think Alfaisal also, let's say, Alfaisal graduates are very good during these interviews. Just to explain briefly about the future of family physicians in Saudi Arabia. So with the development of the new model of care and the privatization and what's happening basically family physicians would act as gatekeepers at different hospitals. So sometimes you would go to a doctor or let's say a consultant that specializes in some type of field, and then in a certain hospital the waiting list would be quite long and whatnot, and since everyone just goes directly to a specialist, having family physicians as gatekeepers definitely reduces the stress on these different tertiary hospitals and whatnot. And basically as a rule of thumb and from different studies, if you're a really good family physician, you could treat almost 90% of or even 95% of let's say the patients that you get, and you would only refer 5% approximately, and so you'd be treating a huge population and connecting with them. And especially now with the numbers of family physicians, you might imagine that the numbers are quite high, but I think in terms of specialty, they're even lower than pediatrics and internal medicine in terms of an overall number. This year, it also got reduced in Riyadh. I believe during my year, it was around people who were accepted around 225 or 250, and now I think it's 175. I'm not sure what's the reason for that decrease. It got a little bit competitive. However, there's still a huge need for it. So take-home message is that if you really want to have, let's say, a career where you would basically want your patient to live their best lives, prevent things from happening to them, whether it's preventive measures or prevention, let's say, of different diseases, and really connect and see the social, mental aspect of their patients and having them live their best life. I think family medicine would be a great choice for you. And by that, I'm sorry for taking a long time, and I'd like to conclude my presentation, and I'd be happy to answer any questions if you have.
السلام عليكم دكتور، يعطيك العافية.
الله يعافيك.
Just two quick questions. The first one is regarding what you mentioned about the possibilities for future in the country. From what I understand, you need a specialty to guarantee a spot, especially in the major city, Riyadh, Sharqiyya, Jeddah, زي كذا. But compared to, like, for example, anesthesia or ER medicine, are you really in that need? Will you always find a place as a family physician? Well, it's going to be more governmental based, even with privatization. And the second question is, if you go to the fellowship of emergency, do you become like certified with equal pay? Well, is it considered like urgent care, not actual emergency medicine?
Thank you for your questions. So the first question is actually a good question, and so basically regarding the availability or how many spots you would have. Actually, with family medicine, there are so many other spots than other, let's say, specialties. So of course, you would think that, let's say, in orthopedics or some other specialties are highly needed. However, they're highly needed, but maybe there would be some, let's say, in a private hospital and whatnot, there are a lot of, let's say, graduates from internal medicine programs, let's say orthopedics program, who are suffering to find a fellowship, to find a program that sends you afterwards. However, with family medicine, as with the expansions that are happening, a lot of programs are offering. Al-Haras offers 7 seats every year to their graduates to work as an assistant consultant, with the opportunity to send you outside KVSH, I guess, as well, but a lower number of seats compared to other specialties where it would be 1, and in a certain major in a certain fellowship where it's highly needed. So I hope this answers your question, if I'm not mistaken. The second thing is regarding urgent care. I think you're regarded as the same as the consultant. I'm not sure about the exact pay, to be honest, because I know someone who's working as in shift and whatnot, but I was not brave enough to ask them about the pay and how it's different. I would say it's quite similar. It's quite similar, at least in that sense. You could serve basically as an emergency in terms of the more easier ones. So it's not like the resuscitation unit where it's category, I believe, 1 or 2. You would be serving on the other ones, but I believe the pay would be quite similar. And also you could have the opportunity to serve as in urgent care as well. Does that answer your questions?
Thank you, doctor.
Thank you.
Doctor, thank you so much for the talk. Since we are short on time, we'll have to stop taking questions now, but we really value your experience and guidance. We'll move on to the next talk now.
Sure. Thank you so much. And if anyone wants to ask any more questions, please feel free to email me, and I'd be more than happy to answer that. Thank you.